different structures that are found on the heart. And the first thing I want to start off with is the venous system, because the venous blood is what gets drained into the right atrium. So let's identify all of those structures. So these two are both the brachiocephalic veins, so right and left. This is the superior vena cava, and this is the inferior vena cava. So both of these are going into the atrium. And we also have a couple other structures that are dumping deoxygenated blood into the right atrium. So we have the anterior vein, and then we also have the opening here for the coronary sinus. Okay. So let's find where this blood is coming from. So this here is the coronary sinus that I just pointed out. Okay, and so the venous blood has to get here. Well, where does it come from? So if we look on this side, so this is known as the small cardiac vein. So it's going here, and then we have the middle cardiac vein going in here. And then we look here on this side, so this one that's coming down this way, blood is coming up this way. We have the posterior vein of the left ventricle. Okay, and then coming over here, this is known as the great vein, because if we follow it this way, it's very big, right? All of that, the great cardiac vein. So, so that's for the venous structures. Okay. So now that the venous blood is here in the right atrium, we have a couple of different valves. So this valve here, that's the valve for the coronary sinus, and then this valve is for the inferior vena cava. Okay, and then this structure here, that's just the fossa valves. Okay, so now in order to get to the right ventricle, we pass through the tricuspid valve. And if we look at the tricuspid valve, it's anchored by these papillary muscles. And so once these papillary muscles contract, that's what prevents the backflow of the blood back into the right atrium. Okay, and these strings here, these are known as the chordae tendineae. Okay, so that's the chordae tendineae. So now that blood is here into the right ventricle, we need to get it to the lungs. And in order to get there, we have to pass through the pulmonary semilunar valve. So once this valve opens, it allows this blood to travel through the pulmonary trunk, and then the pulmonary trunk is going to diverge into two different parts. Okay, so both of these are arteries, because we're carrying blood away from the heart. So the left pulmonary artery goes this way, and then the right pulmonary artery is coming back this way. And it's different because there are two of these, but there are four of the pulmonary veins. So pulmonary veins, which is 1, 2, and then on this side, 3 and 4, that's what's dumping oxygenated blood, right, because it's already went to the lungs, back into the left atrium. So we get into the left atrium, then we travel through the bicuspid, or the mitral valve. From there, we get into the left ventricle, and then in order to get it through the aorta, we have to travel, the aortic semilunar valve has to open. So the blood is going to travel through here and go through the ascending aorta, and then the descending aorta is this part back here. Okay, and then this is the aortic arch. And what's coming off of the aortic arch is the BCS. So the brachiocephalic trunk, the left common carotid artery, and then this is the left subclavian artery. All right, so now we've talked about how the blood is going to the rest of the body. Well, how about the heart has to receive its own blood supply? Okay, so what is the blood supply? How does it do that? Where does it travel? So let's look at some of the different features. So if we look here, This is so you have the right coronary artery, and then you also have the left coronary artery. Okay, and both of these are branching. They're coming from the aorta, and the coronary artery is going to come down, and then this one is known as the marginal artery. So you have the marginal artery, and then we follow it, follow the coronary artery all the way to the back, and then this one right here in the middle, since it's in between the ventricles and it's on the back side, it's known as the posterior interventricular artery. So then we follow the blood vessel, and then we get to right here. Okay, so this one coming down, this is the left posterior ventricular artery. And then this artery that comes across this way, it comes around, so it's known as the circumflex. So the circumflex will travel over here, and then now we're back at the left coronary artery. And then what goes down here, this is known as the anterior interventricular artery, or it's also known as the LAD, the left anterior descending. So that's the main vasculature of it. Some of the other parts of the heart, so what this is showing here, this is just fat that's around the heart. And then some of the other structures we also have, so this is the esophagus, that's posterior, and then the trachea, which is in the front. A couple of the other ones, this is the azygous vein. Some of the features on the inside. This is known as the Pectinate Muscle, and it's in the atrium. So just remember the pecs are on top, because you also have this structure down here, which is known as the trabeculae carneae. Alright, and let's see what else. So now, let's go over the electrical conduction system of the heart. So you have the SA node, the AV node, and then the part in the middle, this is known as the bundle of His. So you have the right bundle and then the left bundle of His. And then the ones here on the ventricular walls, these are the Purkinje Fibers. And so SA node stands for sinoatrial, and then AV node stands for atrioventricular.